Hi, I am Dr. Ravinder. I am an orthodontist and an implantologist, and I practice at Dentalign, Whitefield Bengaluru. What is a root canal and why is it needed? Now, the root canal treatment is one of the most feared procedures in dental treatment. Now, the reason why it is needed is when you have dental decay and when you have untreated dental decay, the decay can spread through the different layers of the tooth all the way till the pulp or the nerve tissue of the tooth. Now, the hardest and the outermost layer of the tooth is enamel. So when you have decay in the enamel, you may not feel any pain, you may not feel any sensitivity, you may not have any symptoms at all. It can only be detected when you go to your dentist and he or she takes a look and tells you that you have a decay and it requires a filling. The second stage of decay is when the decay spreads from the enamel to the second layer, which is called as the dentine. Now, unlike the enamel, the dentine does have some nerve endings, so you may occasionally have some degree of sensitivity. Now, this sensitivity will typically be there for cold things and also things which are very sweet. Now, that is an indication that you may have decay. A lot of the times you see a lot of misleading ads, especially on television, which will indicate that sensitivity can be treated with the help of this toothpaste or this mouthwash or something like that. But it's most important that you get yourself an accurate diagnosis before you start using that. Because if the decay spreads from the dentine to the third layer of the tooth, or rather the core of the tooth, which is called as the pulp and is soft, you may end up having extreme pain. Now, this pain typically is spontaneous and is triggered by hard food and typically occurs the maximum at night when you are in a lying down position. Now, when the tooth decay has reached to the third layer or the pulp of the tooth, that is when you end up needing to do something called as a root canal treatment if you want to retain the tooth. The other option, if you don't want to do a root canal treatment, would be to look at removing the tooth altogether. In the process of the root canal, what needs to be done is that the deepest part of the tooth is accessed, all the nerve tissue which has died out and is infected is removed, and an inert filling material is placed inside the tooth itself. And the top of the tooth is sealed with a regular filling material. Now, the root canal treatment will take care of the pain that you are experiencing and typically takes about 2 visits over a period of about 4 or 5 days time, and it is done under local anesthesia. So during the procedure as such, you will not experience any pain. Post procedure, you may have some discomfort, which is typically taken care of by painkillers. Now, once the root canal process is completed and the tooth is pain free, you need to restore the strength of the tooth and reinforce the strength of the tooth by placing a crown on top of it. Now, this crown is done by reshaping the tooth, making it smaller, and taking either a digital impression or a regular impression and sending it to the lab. And it takes about 3 to 4 days for the lab to manufacture it, and then it is glued on to the tooth with the help of a dental cement. Now, root canal treatment typically has about a 95% success rate. A lot of it depends on the degree of damage that you have experienced, the kind of tooth anatomy that you have, and in general your hygiene and your immunity. It's very important once you've had a root canal done to kind of follow it up every 6 months so that any signs of reinfection can be checked and detected in an early stage.